Buckle up, folks. This podcast is all about diving into the good, the bad, and the ugly of our bodily, spiritual, and mental experiences. If you are not prepared to challenge your assumptions, laugh at yourself, laugh at me, or maybe even shed a tear or two, then you might want to look elsewhere. But if you're ready to get real, get honest, and get a little weird, then welcome to the Just Chrissy podcast. I'm your host, Chrissy McCammon. Welcome back, friends. This is Chrissy, your host here at Just Chrissy and the owner of Rooted in Wellness, LLC. I love bringing you guys this information. I think I'm going to share my testimony tomorrow. Someone asked me to share my wellness testimony, and I think I'm going to share that tomorrow. And I have done a lot of research trying to figure out my own wellness, and in that, I've gotten, I've learned a lot. I ended up going and receiving my certification as an integrative health practitioner. But I've also, I feel called by God to do this, and I'll share that tomorrow. But I have some shocking things I want to share with you today. Some numbers that I really want you to consider. There was a point in my life that I didn't even know I had other options except to go to the doctor. And listen, I have doctor friends and nurse friends that really love people and really want to do right by them, but they are in a system that chokes them. They have a limited amount of time to see a patient. I think it's 10 or 15 minutes now they're allowed to spend with the patient. They're only allowed to address one issue, and it's usually give them a prescription. And and then they have to see so many patients a day. And then I know my friends that are in this field spend a lot of their free time trying to write up all the reports because they don't have enough time through the day to do it. And my question is, when do they even have time to look at new research? And then on top of this, they don't have training normally in nutrition, which is what your body is built off of. So I just have a hard time with this system. And so as I've been researching and learning since 2017, so what is that, 7 years now, there are some things that I have learned that have shocked me. And one of them is the Rockefeller podcast that I shared a few days back that's in this 30-day reset. If you've not listened to all of these, go back to the beginning and start there because they do kind of build on each other. But I have some numbers today that I'm going to share with you, so stick in here. One of the numbers is 15,749 in the U.S. Another number is 250,000 to 795,000 per year in the U.S. And the other number is 10,000, and that was in 2023. I know you're probably asking, what do these numbers have to do with me? Well, let me ask you a question. If 3 jumbo planes fell out of the sky every day, do you think that there would be pause? Do you think there would be questions? Do you think there would be investigations? Do you think somebody would be doing something about 3 jumbo planes falling out of the sky every day? I think we're in agreement that yes, something would happen. However, that's what's happening in the United States every year. There are 200, according to Johns Hopkins, an article I read from July of 23, there's 250,000 to 795,000 people dying from allopathic being the current medical system, the pill for an ill, the hospital, the current medical system is allopathic. There are 250,000 to 795,000 people dying every year in the United States due to allopathic mistakes. Let's just use the number 251,000. 251,000 medical errors, the third leading cause of death in the United States. And if you took that and you divided it out into a 200-passenger plane, that would be 3.5 planes a day, only at that nominal number of 251,000. Is anybody else gasping in disbelief at this number? This is why I really encourage people to be their own advocate. When you go to the doctor, You share the information with the doctor. The doctor gives you their advice. You don't work for them. You are not obligated to them. They work for you. And I don't mean that in a disrespectful sense at all, but they are your medical health advisor. It's just like when you come here to see me as your practitioner. I tell you my opinion on what I think you need to do, and then you get to decide whether that's what you want to do or not. And I do think too that like people they just forget to invite God into their decision making. So I always will encourage people, invite God into that decision making. When something comes up, don't just go and start, run into all the doctors. Like, pray about it first. Then what always happens for me and for my clients when I am working with someone, I pray about them, I pray for them, and then God will send me information. It is so interesting. Every time, though, he sends me information. And so make sure you pray about it. Then you go to your doctor and you have that discussion with them. They are really smart in a lot of things. I do keep in mind that they are educated by the pharmaceutical company, as we learned in the Rockefeller podcast. And if you have not listened to all 30 days, go back to the beginning, please, and start listening there, because they build on each other. And I talk about how Rockefeller took over the holistic care and turned it into an allopathic healthcare system, which is what we have today. But if this allopathic care is so wonderful, then why do we see so many sick care buildings going up and so many more sickly people? I personally think this generation of children will not outlive their parents, because the parents don't have the knowledge and the kids aren't being raised with the knowledge. And no one's coming to save us. No one is coming to save us. We have to do the work, and we're the gatekeepers to our homes. If you are a parent, you're the gatekeeper to your home, and your children and their future is dependent on your investment into learning what you need to know to be healthy. I told Stan the last time we came back from Indiana, I said, I think the next time we go back out to Indiana, I'm just going to count all the sick care buildings along those main roads as we go out. Just count them and see how many there are, because they are building them all the time. Every time we go out, there's all kinds of new sick care buildings going up. It's not health care, because if it were health care, people would be getting healthy. They're not. They're more sickly. I think it's interesting too that like a pharmaceutical store is called a drug store. And if you've never watched the movie or the series Dope Sick, that would be a great series for you to go out. It used to be on Hulu. I'm not sure where you can find it. Hopefully still out there. But it was such a good series showing how the opioid crisis happened and how they lied and manipulated. And it's awful. Like people get on a prescription for some reason, not all people, but you do have to be very, very careful when your pharmaceutical says there's all these side effects. Please take them seriously. There are some serious accusations that happened for them to put that on that label, because believe me, they don't want to put those on that label. Each pharmaceutical has an average of 70 side effects. If you want to know how that happens, on my Rooted in Wellness Facebook page, I did a essential oils class. It's pinned at the top. You can go in there. I think I explained how side effects happen with pharmaceuticals, but not with essential oils. Anyway, so pay attention to those and take them seriously, because a lot of people have suffered before they put that on that label. So they did. Okay, so how'd they come up with this number? I know you sciencey people are probably saying, how'd they come up with that number? That's what my husband would be saying. Well, recent studies of medical errors have estimated errors may account for as many as 251,000 deaths in the United States, making medical errors the third leading cause of death. Error rates are significantly higher in the United States than in other developed countries such as Canada, Australia, New Zealand, Germany, and the United Kingdom or the UK. So at the same time, keep in mind, less than 10% of medical errors are even reported. This study describes the results of an investigation of the effectiveness of the implementation of, it's called MEDMARX, MEDMARX, and that is the medical error reporting system in 25 hospitals in Pennsylvania. And they collected data on 17,000 errors that were reported by the participating hospitals over a 12-month period. And so then they did a growth curve analysis and revealed that the reporting of errors by healthcare providers increased significantly over those 4 quarters. So at the same time, the proportion of corrective actions taken by the hospitals remained relatively constant in the 12 months. So they did this model, and they did like 4 interventions that were simulated, and the results suggested that improving patient safety requires more than voluntary reporting. It does. But you know what's really frustrating is that they don't even have education in nutrition, which is how your body lives. Like, food turns into life in the blood, as we learned in the digestion podcast. So it's important that you keep in mind these statistics, the impact of them, especially when it comes to trusting the medical system. Like so you go to the doctor, you pray before you go, you invite God into this decision making that you're doing because He made your body, He knows exactly what's going on in it. You go to the doctor, you tell them what your symptoms are, whatever, and then they're going to come back with some sort of what should be advice. They work for you. You don't have to listen to what they say. You are an individual who has the right to make decisions, and you should go in with knowledge, which is power. And whatever recommendations they give you, you say, thank you so much for your input. You take that information and you go home and you pray about it before you make any decisions. When you come to see me in a consultation, like, it just drives me crazy that they only have the 10 minutes. When you come see me, like, you've already done your intake paperwork before you even get here. I've already looked at that and spent time evaluating it. And then we spend 90 minutes going over everything because your body is so connected. And you can't just deal with one thing and it not be connected to something else. So, I don't know if I mentioned this, but I'm not a doctor. I can't diagnose, treat, cure, any of that. But I can, like, give you advice on being wise and the things that will help you in your decision making. So we had 250,000 to maybe 795,000 deaths per year due to allopathic mistakes. This is another interesting number. Guess how many pharmaceuticals were pulled off the shelf since 2012? Pharmaceuticals pulled off the shelf since 2012. 15,749. Like 15,300 of them are in the United States. That should give you a moment to pause. If you have to use a pharmaceutical, try to find one that's really old and isn't going to be so risky. And then the other interesting statistic I found is more than 10,000 research papers were pulled in 2023. 10,000 research papers were pulled in 2023. The other thing you have to watch too with these studies, that you have to go look at them, because they'll say, oh, well, this study says that you have, a 50% chance of whatever if you take this pill. Well, if you go look at the study, there might only be 2 people in that study. So you have to be really careful when you're hearing like someone using the word study. And then the numbers can be, and this is a whole nother podcast and I'm almost out of time, the numbers can be easily manipulated in these studies. So you have to be careful with them. So use wisdom, take this information, go out knowing that You have the right to say no. You have the right to think about things, to pray about things, and to look at other options. In 2017, I didn't even know there was another option. So if anything, I hope that this podcast is teaching you that there are other options. And many of them, the best practices to be proactive, is the ones that have been here since creation: sunshine, clean water, exercise, good sleep, etc. All the things we're talking about in this podcast that are basically free for you to do. You have to discipline yourself. No one's coming to save you. No one is coming to save you. You have to discipline yourself. And our children, you are the gatekeeper of your home. Our children are dependent on you to discipline yourself and also to be the parent and be the gatekeeper of your home. So 5, 4, 3, 2, 1, high five. I know this is a tough one, but go out and make wise decisions.